Assalamu alaikum. Now I would like to talk about the vaginal tumor. Starts with squamous cell carcinoma. Squamous cell carcinoma. In vaginal tumor, there is squamous cell carcinoma, there is clear cell adenocarcinoma, and there is sarcoma botrytis. Sarcoma botrytis. Sarcoma botrytis. Squamous cell carcinoma, clear cell adenocarcinoma, and there is sarcoma botrytis. In squamous cell carcinoma, usually secondary to cervical. Squamous cell carcinoma usually secondary to cervical. Hmm. Squamous cell carcinoma. Primary vaginal carcinoma are rare. Primary vaginal carcinoma are rare. Clear cell carcinoma, it arises from vaginal adenosis. So vaginal adenosis, persistent of gallbladder columnar epithelium in the proximal vagina. It is found in female who had exposure to what diethyl stilbestrol. So patient, patient having an exposure to diethylstilbestrol may have a clear cell adenocarcinoma, and it may be due to it arises from vaginal adenosis. And embryonal rhabdomyosarcoma or sarcoma botrytis. Sarcoma botrytis has embryonal rhabdomyosarcoma variant, affects female less than 4 years, spindle shape, spindle shape, spindle shape cell, desmin positive, spindle shape, desmin positive, and presence with clear grape-like polypoid mass emerging from clear grape-like polypoid mass arising from vagina. So these three things, in a nutshell: squamous cell carcinoma, vaginal tumor, squamous cell carcinoma, usually secondary to cervical. The one word is cervical squamous cell carcinoma. In clear cell adenocarcinoma, it arises from vaginal adenosis in a patient who have having exposure to diethylstilbestrol. And last, sarcoma botrytis. In here, it is rhabdomyosarcoma variant. It affects female less than 4 years old. It is spindle shaped, desmin positive. And presence with clear grape-like polypoid mass emerging from grape-like mass emerging from vagina. Now, cervical pathology is dysplasia and carcinoma in situ and invasive carcinoma. Dysplasia and carcinoma in situ and invasive carcinoma. In dysplasia and carcinoma in situ, and carcinoma in situ, it is a disordered growth begin at the basal layer of the squamocolumnar junction. Suppose this is squamocolumnar junction. This is the basal layer. It arises from the basal layer or from the transformation zone, and it is extends outward. It is classified as CIN1, CIN2, CIN3, severe. CIN3 risk factor is multiple sexual partner, multiple partners, one HPV, smoking, smoking, early coitarchy, diethylestylbestryl exposure, and immunocompromised like HIV and transplant. These are the risk factor of uh, cervical pathology, carcinoma in situ. Risk factor. So CN1, CN2, CN3 risk factor are multiple sexual partner, early coitarchy, HPV, smoking, diethylestylbestryl, and immunocompromise. It is associated with HPV 16, 18. It is associated with HPV 16 and 18, which produce E6 and E7 gene product. E6 and E7 gene product. E6 gene product inhibits P53, and E7 gene product and E6 gene product and E7 gene product inhibits RB gene, PRB gene. A6 gene product inhibits P53 and E7 gene product inhibit RB gene. In here you will get number one important coilocyte. If you get coilocyte in a question, it is CIN. Coilocyte, which is cells with wrinkled racinoid nucleus and perinuclear halo. Perinuclear halo. Cells with wrinkled racinoid nucleus with a perinucleus halo are pathognomonic of HPV infection. Coilocyte is a pathognomonic for what? HPV infection. It may progress to invasive carcinoma if left untreated. If it is left untreated, it may cause invasive carcinoma. Typically it is asymptomatic, and it is detected via pap smear. And presents as an abnormal vaginal bleeding, often postcoital. And the last one, that means in invasive carcinoma, in cervical pathology, in invasive carcinoma, often squamous cell carcinoma, pap smear can detect cervical dysplasia before it progresses to the invasive carcinoma. Diagnosed via colposcopy and biopsy. Diagnosed via colposcopy and biopsy. Lateral invasion can block ureter. Lateral invasion can block ureter, can lead to hydronephrosis and renal failure. Lateral invasion can cause nephrosis and can cause renal failure. This is all about vaginal tumor and cervical pathology. Hope you enjoyed.